budget, especially slashing of the budget by 5.6 billion shillings as compared to what was allocated last year. And in the 2022-2023 budget allocation, the health sector was among the biggest beneficiaries, and the health sector allocation stood at 146.8 billion shillings. But this time around, the budget allocation for the health sector stands at 141 billion shillings, and therefore we've seen a reduction by 5.6 billion shillings. That conversation, just having a conversation on what's happening and whether this was really, justified. To help us with this discussion, we have Dr. Catherine Nyongesa, who is the CEO at the Texas Cancer Center, and also we do have Situma Wafula, who is the Special Programs Officer at the Kenya Union of Nutritionists and Dietitian. That's Kunad. Welcome, and thank you for being part of our conversation this morning.
Thank you so much for having us.
Yeah. And when we sat and saw that this year there was a reduction, when the CS was reading the budget last week on Thursday, there was a lot of concerns that why did the government have to slash the budget by a whole 5.6 billion shillings amidst concerns of outbreaks, and we are still, COVID-19 disease has not yet been declared, that it's over. We've seen a resurgence. Uganda President Museveni had been diagnosed with COVID, and so a lot of concerns on also the effect of climate change on health. But here we are that the health sector again has seen a reduction in the allocation. So what's your take on that, Catherine?
Yeah, thank you so much. So I understand these are difficult times, and it's a global problem, which has been brought about by the wars that are going on in Ukraine and Russia, and also the impact of COVID-19. We've also had change of government. So all those things are contributing to a difficult economic times, and with the slashing of the budget to health, we have to review. Maybe it's a wake-up call that how will we make this work, and we'll have to review where the gaps are, how can we reduce the spending so that we can accommodate the funds we have more effectively to support our healthcare.
Yeah, and again, Situma, when the CS was making his remarks, he did acknowledge that the budget was formulated in the context of numerous external shocks, and some of them are the COVID-19 pandemic. But again, we saw a reduction by a whole 5.6%. So acknowledging that we still have a problem in the healthcare sector, but again, slashing the budget, what would you take? What's your take on that?
I would see it as that is retrogressive. Population is increasing. The burden on healthcare is equally increasing. When you look at healthcare workers, it's the first time that this country is having doctors not being absorbed.
Yeah.
So at least we expect a step ahead, an addition. But when you have a reduction on the same, then it's not justifiable. Because let's look. Before COVID, economically we were doing betterly.
Yeah.
COVID came in. We see how economically everybody's complaining. Yes. But then, for we to have a working and a productive country, we have to invest in healthcare. Possibly, maybe the government sees that healthcare does not carry substance. But if you have a healthy nation, you have a productive nation.
Yeah.
And to just on that, if now we are reducing on these people's productivity, then it means we're doing very badly. Like, just to be exact, now on the same budget, I saw the allocation on the universal health coverage, which is the primary sector of health.
And there was actually a drop by 43.9 billion shillings for UHC.
Last time we had done 62 billion. Now we're only doing 18 billion. It's expensive to invest in curative health.
Yeah.
And if we did proper investment in primary health care, then in the next 5 or so years, we'll have generally a reduction in the expenditure that we get in financing curative.
Yeah, and Dr. Let's talk about that, because health experts have been advocating for preventive, instead of curative. But when you look at the budget allocation, the curative and reproductive health, we see a 21 billion allocation. When it comes to UHC, it's 18.4 billion shillings. What really advised this? What's your comment on this? I mean, we are advocating for health for all, but again, we are slashing this UHC allocation. At the same time, we are giving more money to curative, which experts say it's better to prevent than to treat.
You are right. Prevention is better than cure. And if we sort out 90% of the issues at the primary health care level, you find the treatment aspect will only contribute 10%. So a lot of resources needs to be put back in the UHC and not the curative aspect. But it just shows how, as a country, we still have a lot to cover, a lot of ground to cover, because we have to strengthen that primary health care, the prevention of cancer, early diagnosis, people having to adjust their lifestyle, the county governments really going to the ground and strengthening the health care in that aspect before now patients get a referral to tertiary healthcare facilities. And at Kenyatta National Hospital, we have what is called the Patient Navigation Program, which was has been running for close to 6 years, supported by the American Cancer Society, and it has exposed some of the major gaps that patients face. One is just financial. So financial is like the key. Second is the lack of knowledge. They are not aware about their disease, what is expected of the treatment, and then the physical barrier. They really have trouble navigating from Mashinani to come to, say, Nairobi for treatment. And then there are also family commitments. When you fall sick, you need family support, but people are busy. They are working or they have their children to take care of. Now they have to stop everything and take you to hospital. So all this causes a lot of delay in a patient getting timely treatment. So we also need to put resources back in the UHC so that we navigate some of these barriers, we overcome them. We have early diagnosis, timely treatment. People are aware that they actually have cancer and get treatment quickly. Then apart from the treatment itself, we have palliative care. You also have to look at survivorship after treatment, then what next? So there are a lot of aspects that we need to look at, cancer and finance, and it's a very broad in kind of investment. It's not just at one point.
And
it's a journey.
Let me stay with you. When you talk about cancer, it's the third leading cause of death in the country. The country, or Kenya, has allocated 22.55 billion shillings for the fight against cancer. There's also an additional of around 500 million shillings, if I'm not wrong, for establishment of cancer centers. But when you look at the history of this country, we spent over 10 billion shillings every year. Kenyans seeking treatment outside, not because we don't have the right doctors, but sometimes the centers and the facilities become an issue. Again, the question is this allocation enough in the fight against cancer?
It's not enough, because cancer is a complex disease, and even those seeking treatment outside, it is quite expensive. So being a complex disease, you are looking at, one, the diagnosis part of it. There's a different doctor involved. There is the staging part of it, like you need CT scans, MRI, PET scans. And then you look at now the actual treatment, which is chemotherapy, radiotherapy, or surgery, or a combination of the same. And most of the diseases, the cancer problem, can be sorted out locally if we invest more in the resources, and only a small percentage qualify to go overseas. And as a country, there's a vetting system to ensure that really the treatment the patient is going for overseas, it is not available locally, and it's the standard of care for that particular diagnosis.
Yeah, right. And Sifuna, you...
Yeah, just to add to what Dr. is
not
saying.
Sifuna, but Wafula.
Yeah, Wafula.
Yeah, sorry about
Now,
that.
you see, we're not just looking at cancer.
Yeah.
Let's look at NCDs as general. From the Kenya National Statistics Bureau, done 2019. As we speak, the NCDs, non-chronic diseases, have taken over. Previously, we were talking about HIV and the rest. Now, cancer, diabetes, hypertension are beating all that communicable diseases. You understand? So, as we are trying, as you see, the government is limiting the budget. The disease is not limiting itself. One. Two, healthcare is developed. But the national government is retaining the biggest share of the whole health budget.
Yeah.
141 billion at national level. This is a function that was wholly developed.
Yeah.
Apart from Kenyatta National Hospital, Moi Teaching and Referral Hospital, Mathare Mental Hospital, with which also the same Mathare Mental Hospital, which is a national referral hospital,
there's no allocation.
There is no allocation.
Yeah.
So, where is our priority? Is our priority in housing?
Yeah.
I don't think a sick person needs a house.
Yeah, and actually my biggest concern was the fact that we were having a lot of conversations about mental health, but when I looked at the allocation on the health budget, I didn't see mental health featuring anywhere, unless it lies on one of these terms used here, curative, you know, I'm not sure about that.
I don't think there isn't, because because we have on the 6 referral hospitals of the country, Kenyatta, Moi, Mathare, which is recently being part, it has not been allocated anything.
Yeah.
So to me, it's operating on its own revenue it generates. That gives us another phase, which of course now as we talk, possibly 30% of the population is getting affected by mental health. Is a whole issue.
Yeah.
Then on cancer, for example, the cost of managing a cancer patient per head from NHIF is not less than 500,000 Kenya shillings. To do chemo and the rest, it's not less than that. But now if you invest in, is it 1.2 billion? Let's do that calculation by, let's say 55 million Kenya shillings divided by 1.2 billion. That's not even 100 shilling per head.
Yeah.
Per head. Let's say now we want to prevent. But of course now we want to cure. But let's say now if we are going to do curative. Recently the CS did a good program, what called Primary Health Network.
Yeah.
Very brilliant. But execution. The community health volunteers. Something that has been talked of since 2017 when we were launching UHC. None is being executed. Now we want to do a combined, a multidisciplinary team that is going to be made of community health worker, a nurse, the private sector, the public health sector. Can we be able to execute that?
Yeah. And even before we look at the misses in this year's budget, because we've highlighted, for instance, what has been put for cancer treatment, for preventive, let's look at is it repetitive allocation, or what do I call it? Because, for instance, we've seen a budget of 1.3 billion shillings allocated for the construction of a cancer center that's in Kisii Level 5 Hospital, and that was allocated last year, the 2022-2023 budget. There was a 1.3 billion shillings for the Kisii Cancer Center at the Kisii Level 5 Hospital. This year again, the 2023-2024 budget, there is a proposal for an increment from 600 million, by 600 million to 1.9 billion shillings. Now the question is, in the same case for the construction of Kenyatta National Hospital, Burns and a pediatric center. So when you look at this allocation, there's an additional 1.1 billion shillings, and there's another 2.4 billion shillings for the Kenyatta National Hospital. So the question is, why has this allocation been repeated, and what happened to the previous allocation? You know, it's good for Kenyans to understand that, so that we see whether this allocation again should have been given to the mental health care services. Was this necessary, Catherine?
I think it's necessary. For instance, let me talk about Kenyatta Hospital Cancer Center.
Yeah.
We are constructing a cancer center of excellence, and this is supposed to go like to 10 floors. So from previous allocation, we've only managed to do 2 floors, ground floor and first floor. So you also need to continue the construction to make it better. So whatever budget allocation, it has to be, it is in small bits. So every year something has to be allocated to continue the construction, because you cannot allocate all the money at once, because the funds are usually not all available. So it is quite in order that the investment in cancer is major. Apart from infrastructure, you need to put equipment, machines. For instance, cancer KNH, we are constructing 2 new rooms to put new equipments. So that is also funding that is required. After we construct, we need to put now the machines, and all that costs money. So I think it is in order that these funds are allocated on annual basis to continue with the infrastructure until it is completed. Yeah.
Okay. So we also have allocation on COVID, you know, COVID-19.
But just on that.
Just before that, all right.
On that cancer allocation, let's look at Kisii level 5, the allocation.
Yeah.
Level 5, Kisii is under county government. County government is going to allocate money to the same, Kisii level 5. Then we have this allocation again. Possibly, would we have something of the equipment, the medical equipment that were procured then, plus stud centers? We had them all over the counties. What did they help? Have we had any reduction in diagnosis? Possibly, maybe we've had some improvement a little bit. But we put equipments there, you understand? There are no personnel. Nobody to run them. They gather moss and dust. Then we are paying for them in the same budget. It has been allocated. So a little bit, I don't know if it's missing of data. There's no data to support the allocation, possibly, or is it just we are allocating because it's there and it's being provided? Then we do. Also, let's look at the same budget absorption. Like, I was looking at the statistic on the last absorption of the budget.
Right.
Not all this amount allocated is being consumed. Not all of it, because I think the best county that had absorbed almost all its allocation on health was Nakuru County last time, which had done around 87% of the whole budget that was allocated. The rest of the counties were doing with 73, 66, which then the same amount of money is sent back to the treasury. So then, why do we keep allocating this money to these people, Adams, who do not use the same amount? You get? So, a little bit proper assessment of the groundwork. You get? Then from there, let's put the investment, let's get the right people to run before we just bump in money. You get?
Yeah, all right. And I'll finish up with you on the issue of human resource, because we've had healthcare providers in the country complaining that we do not have enough doctors, we do not have enough clinicians, even nurses, but not before Daktari. According to the 2010 Constitution of Kenya, every Kenyan has a right to health. And let's talk about the misses in this budget. As you sat down and listened to the CS, what were your expectations as an expert, as a doctor of this country? Yeah.
So one of the misses is that I think with the reduction in allocation to health, we know that the dollar has gone up.
Yeah.
And as a country, we are importing most of the drugs. So the exchange rate has really gone high. The cost of medication has become even more expensive than 2-3 years ago. So that is something that they needed to have factored in the same. On training, our universities need to be strengthened to offer education for the doctors, the nurses, and the clinician, and all people involved in cancer care. So I would say that, and then the other things that when we look at cancer patients, there still has been a lot of complaints that they cover, the NHIF is not comprehensive. There's a limitation. Like say chemotherapy, you are allowed first line 6 cycles, second line 6 cycles, radiotherapy allocated 20 sessions. The surgical package is also not comprehensive. So these are things we're looking at how can we best improve the healthcare allocation to overcome some of these barriers that patients have been getting as they journey to seek care.
All right, and you want to add on the misses, especially on the mental health, that was very conspicuous that we didn't have an allocation. Maybe the counties, because this was a national government allocation, but do you still feel that, I know we have national government facilities, so what happens to that? The human resource, every year we see, healthcare providers go on strike and they say, we are not being remunerated, that's number one, we're not even being paid well, that's number two, and also the fact that they are going on strike because we don't have enough personnel so that one doctor can take care of up to more than 100 patients at the same time. Yeah.
We're still doing badly in terms of human resource.
Yeah.
Because we expect that as per the agreement and recommendation by WHO, there was an agreement our ministry signed of the Abuja declaration that we have to dedicate 15% of our GDP in terms of that to healthcare. Now, all that budget, as we look, especially for the counties, 70% is being consumed by human resource, you get, with which we are not still equally doing so well with 70% because it is the first time that we are finding the doctor-patient ratio we still not have achieved that what is required, because I think one doctor is supposed to cover around 1,000 patients, but we still one doctor seeing almost 10,000 patients. It is the very time now that we have like interns, doctor interns have not been paid. We have cadres, like now if I talk about nutrition, which is the basis of primary health care and prevention, there's no employment of nutritionists.
Yeah.
Like in the whole country, you have around 1,000 nutritionists who are employed. That is a very small number, serving 55 million. Finally, also, just other than mental health, you look at programs, most of healthcare programs are being supported by donors. Now, when these donors pull away, that is the end of those programs.
All right.
So it's a whole messy and retrogressive thing, and this is pushing so many Kenyans into pocket spending, which I think that around 1.5 or so million Kenyans are getting into poverty because of bills they are catering. So this budget, a little bit the government has to just shift and we get the political goodwill, just the same way they're putting the goodwill in the housing, in education, in military and security, so that everything is also put in healthcare, so that we also have, with a healthy nation, we're going to have people who are going to be very productive.
We have to wrap it up, maybe in 20 seconds. We've talked about the problem, but now how can we work with these resources that we have, or is there a second chance that the government can look into this and increase more funds, case in point, in the cancer fight? Yeah.
So for me, I would say we need, as a nation, to encourage people to register for insurance, like NHIF and any other insurance of choice, so that you don't wait when you are sick to now start registering, because that leads to adverse selection. And number two is that we also need, as a nation, people need to be aware of what are the common cancers, what are the symptoms, so that they don't delay in seeking care. When cancer is detected in late stages, the cost of treatment is very high.
All right.
And also request the government to relook into allocating more funds into healthcare.
Yeah, thank you so much, Dr. Catherine Nyongesa, CEO, Texas Cancer Center, and Situma Wafula, Special Programs Officer at the Kenya Union of Nutrition and Dietitian. That's Kunad. Thank you for making time for us. For that. All right, thank you. And that brings us to the end of News Center this morning. Many thanks for watching. My name is Purity Musianzuki.